Acute brucellosis tends to manifest itself after an incubation period of 1 to 4 weeks, but can present as late as months after initial exposure. Acute brucellosis is characterized by the classic triad of undulant high fevers that are paradoxically well tolerated, drenching sweats with a, quote, wet hay scent, and migratory arthralgias and myalgias. Other symptoms include low back pain, weight loss, weakness, fatigue, malaise, and headache. Physical examination can demonstrate lymphadenopathy and/or hepatosplenomegaly. Routine laboratory tests typically are nonspecific and may reveal leukopenia, anemia, pancytopenia, and/or transaminitis. However, as mentioned earlier, brucellosis can infect almost any organ system. In fact, roughly 30% of cases have additional focal manifestations, particularly skin and tissue abscesses, spondylitis, orchitis, epididymitis, and in infected pregnant women, spontaneous abortion. As shown in this slide, these manifestations can vary tremendously. This slide represents an example of osteoarticular involvement. This CT shows the partial destruction of the symphysis pubis in a woman who was infected with B. melitensis after ingestion of unpasteurized goat cheese. Acute brucellosis can be difficult to clear, and unfortunately, relapse is frequent, up to 5 to 15%. Relapse usually occurs within 6 months, even as late as a year after treatment. It is often the result of either a localized focus of infection, such as an abscess or osteomyelitis, or inadequate treatment from inappropriate antibiotic choice, inadequate duration of treatment, or medication non-adherence. Acute brucellosis can also become, quote, chronic brucellosis if localized infection persists or relapses happen a year after the onset of the original diagnosis. This slide represents an example of osteoarticular involvement in a case of chronic brucellosis. This X-ray of the lumbar spine shows loss of joint space between the second, third, and fourth lumbar vertebrae with anterior irregularity, bone sclerosis, and prominent anterior hypertrophic spurring of the vertebral bodies in a farmer from India living with chronic brucellosis for over a year.